1996, I married Prince Charming.
Uh-huh.
Had one son at that time, and my husband wanted to have more children. He hadn't had any children when we married. And so I had my tubes already tied at that point.
Mm-hmm.
And I found you, I believe I found you somewhere in a phone book in Fayetteville, North Carolina, and did a little research, and we came out and talked to you and felt certain that it was something to try. Came and had surgery, and I still remember it being probably the best surgery I'd ever had.
In what way?
In just that there was no side effects afterwards. I was up and running a few days later, just felt 100% better.
Uh-huh.
Yes, see. And so it was a very quick recovery, which was wonderful for me because I'm very active.
Uh-huh.
And then I went through a long 4 years of many pregnancies. I became pregnant 8 times from the time I had my surgery. 3 were tubal that were treated immediately with methotrexate, and there were no residual problems with that. I had an HSG done shortly afterward to find out what was going on with my tubes. Everything looked great, patent, everything was in good shape.
Mm-hmm.
And so just out of the blue one day, I got pregnant and found out I was pregnant with Samantha. And then just another 2 years later, or actually it was a year and a half later, became pregnant with Max. And then I suffered one miscarriage between the 2 of these guys, and then I got pregnant with Alex. And they are all Thanksgiving babies. I think Thanksgiving. Well, they were all born in August, so Thanksgiving seems to be the time of year for us.
I see.
And so it was a great success.
That's
and
good.
I would have never thought I'd ever had any of them. So it was a real blessing.
That's pretty neat.
It is
And
amazing.
you got a beautiful family. Why? You said you had 3 ectopics. What made the doctor think they were ectopic?
And actually, a lot of times it was very hard to tell. I was having tests done, blood tests. I forget what the quantitative.
ECG.
Right.
Mm-hmm.
I was having quantitative tests done, and they would do little weird fluctuations and go up and down. They never actually saw tubal, believe it or not.
Right.
Never saw it on.
So probably these are pregnancies. They're just not normal pregnancies.
Exactly.
And we don't really know if they were ectopic, or they might have been miscarriages, or what would have been a miscarriage anyway.
Right, could have been. A lot of the symptoms were consistent with it, and that's why they went ahead and treated with methotrexate, which I thought was very smart, and it did not. I mean, to me, that was just the best. I've gone for a little while. That's an event to let people know that my experience was make sure when be testing often, without being discouraged. Test often. Make sure if you're pregnant, you're really keeping track of what's going on, because that's really going to give you an overall good outcome. And that it is one of those things you have to just be just diligent about and not lose hope.
That's
just
important.
Hold on to your faith and just keep trying, and it does work, and that's the proof. And so it's just good. It's just a good thing, and if you just what you're doing is awesome. You stay mentally on track. I'll tell you that. And understand that there's a healing process that has to go on with those tubes. Those tubes have to heal. They have to do their thing. And if you can wait that out, you eventually will see that your body does respond well, and it will heal, and it will you'll have babies.
Well,
for most, I think that's true.
It is true, and I think your point about not losing hope is really important, because sometimes people will have maybe an arbitrary period of time. If they're not pregnant within 6 months or 12 months, they give up, or think it can't happen, which of course you never can predict when it will happen, or how many times.
Right, or how many times, that's true.
So.
And in my instance, I was pregnant a lot. I stayed pregnant. I was pregnant back to back. I'd give myself time to recuperate from my miscarriage or whatever I was going through, and then it was, get pregnant again. 8 times.
Wow.
In 4 years.
In 4 years.
In probably a little less than 4 years. Yeah, less than 4 years. Because we were married in 96. She was born in 2000. And you were born in 2001. 2001. So, and my surgery wasn't done until 97.
Mm-hmm.
So it's
she was 4 years.
She was, yes.
4 years later.
Yes. Yeah.
Interesting.
Yeah.
Had you started to think that you weren't going to?
I did think that I wasn't going to. And so, I mean, you know, that's just, I think that's a normal response.
Mm-hmm.
But I guess that was my hope, was to tell the women, that, you know, the people that are involved in this process, just to not lose hope, because it is a process. Like I was saying, I think for some it will happen immediately, but there are many that are going to wait a long journey.
Mm-hmm.
And if they can just stay focused and not get discouraged, and, you know, hold on to their hope, that they will, and I think it will happen. And like I said, I think everybody's healing process is different, and everybody's, you know.
That's true.
So,
Yeah.
yeah. And having a good doctor a good obstetrician or gynecologist that's on top of your case, that
Very
knows your
important.
history.
Absolutely.
And yeah, because
and
I have
knows that you've had the surgery. And
Exactly.
will be supportive.
Right, and
Yeah,
I did
no.
have that. So
That's important too.
Yeah.
Not to be discouraging, you know, the doctor himself, you know, trying to
right,
discourage you.
right, yeah.
Do you
Yeah.
think the fact that you exercise and work out is?
I would say that every woman going through this process needs to really focus on improving themselves physically, spiritually, mentally, in whatever way they can. Eat good food, nutritious foods, exercise, and keep yourself psychologically and spiritually healthy.
Mm-hmm.
And then you're in a better way, you know, better position to let this thing, you know, run its course in a positive way. Yeah, definitely. I think exercise is a real key too.
So, and you're, if you don't mind my asking, how old are you now?
I'm 43.
43.
Yes,
Okay, so he was born when you were 40.
exactly. Yes.
Oh boy.
Yeah. So yeah, we conceived him when I was 39, and he was born after he was born. I turned 40,
Uh-huh.
just a few months later, 6 months later. I honestly can remember when I first came here, thinking, it can't work. How can that work? Is it possible?
Yeah, really.
So
That's
I mean,
really
that's really the
is.
thought. And so now looking at it, I would recommend it to, you know, any woman who's, you know, hindsight's 20/20.
Right.
You know, we go through life and we say, well, never will I do this, or never, you know, and we do things that are like have our tubes tied,
Mhm.
and we say it'll never happen. I'll never find Prince Charming like I did.
Mhm.
And then you realize that that's not life. Life changes all the time, and then this gives you an opportunity to go back and say, okay, well, I made a decision thinking it wasn't gonna, you know, I was ever gonna be in this position, and now I'm here, and I really want to have more children, and this makes it possible.
Right.
Really possible.